Hi everybody, and welcome to today's in-service on mouth care in the elderly. My name is Cynthia. I'm the home care supervisor for the Glens Falls office. Welcome. Let's review some housekeeping before we start. Attached to this video is a link to the learning packet. You'll need to download that learning packet or print it out to refer to and read over before taking the test. The next link will be the link to the online quiz. Once you have watched this video, you've reviewed the learning packet, you have taken the opportunity to speak with a nurse about any questions that you have regarding today's content, you can go to that link and take the quiz. If you have any issues with that, you also can come into the office and take it as a paper quiz. Again, if you have any questions at any time, there is a nurse during regular business hours to come in and sit down and review any questions that you have with today's content. You want to avail yourself of that before taking the quiz. Okay, so let's go ahead and get started. Mouth care obviously is very important. The mouth is the vehicle through which a client and ourselves get nutrients. It's very important to keep it in optimal health. Good oral hygiene can never be underestimated. Keeping the mouth, the gums in good health is just so very important. And your role in that is often pivotal because in many cases you are the person that's with the client the most. So let's talk about some of the common issues that we have with our people regarding oral care. Our first one is dentures. Some of the issues that we find with dentures. Number one, we have clients that don't clean them properly. Clients that might take the dentures out but don't clean their mouth. So some of the ways that you can assist with that. Ideally, the dentures should be taken out at least twice a day and clean. So that means brushed with a soft bristle brush and toothpaste. Rinse them off. You want to use warm water, not hot. After you get done cleansing the dentures, if the person is not wearing them, they should go into a denture cup. Obviously, you want to make sure there's always water because the products that dentures are made with need to stay wet. So you need to have always have water, ideally having something to clean the dentures with, a tablet of some kind in the water. And they should soak in that to really make sure that gets them clean. After the dentures come out, it's also very important, and this is often overlooked with our people, is cleaning their own mouth. Soft bristle brush of some kind. They also can use touthettes or mouth swabs, but it's really important. Food can get stuck in the buccal pouches, behind the back of the bone, up inside. And when you are helping them to clean their mouth, you want to keep your eye out for any issues. So you want to make sure, are there any patches that maybe are a different color, they're white, they're red, indicating there may be some new pressure, maybe the dentures aren't fitting as snugly. Those are all very important to keep an eye on. Another thing that can happen to people who have dentures is people have thrush. So perhaps they weren't cleaning their dentures properly. It's warm, it's wet, it's dark. It's the perfect place for fungus to grow. Thrush is a type of fungal infection inside the mouth. Should you notice that, you need to let the nurse know right away. Sometimes they have a coating on their tongue of like a whitish color. It can burn on the inside of the mouth. It is uncomfortable. Usually the treatment for that is some type of medication that's like a swish and swallow because that can get to the back of the throat. So we want to make sure we get rid of that and treat the dentures. So both of those things have to be done. Of course, there are people who experience, all elderly experience changes to the status of the inside of their mouth. They tend to produce less saliva, also puts them at risk for having issues, cracked skin, tongue on the inside of their mouth, dry mouth. So often you see people that use like lollipops or a sucker of some kind, a mint or some such, to keep their mouth moist. Obviously, encouraging fluids. You want to check their care plan to see that they don't have any fluid restrictions, but encouraging fluids to make sure that the mucosa inside the mouth is unbroken. One of the issues we sometimes see in our elderly and our people who are on lots of medication is issues with their gums, bleeding gums. So, they may be brushing their teeth, they spit it out, it's a little bit of pink. Sometimes that's something as simple as they're on a blood thinner. The skin and the inside of the mouth is tender, and they have a little bit of mild bleeding. But if it's new, if it's different, or if you're not sure, the most important thing to do is to call the nurse and report that. It may be something as simple as they're on a blood thinner. It may be something more involved. So again, when you are assisting them, it's important to have a look and see so that you can help the nurse keep track of the status of the inside of their mouth. Certain medications can cause problems to the inside of the mouth. Mouth can cause sores and such. So you are the eyes and the ears. Again, you always want to make sure that you wear gloves when you are assisting with mouth care because they could bleed. The tongue, the gums could bleed, so you always want to make sure that you wear gloves. But keeping an eye on the health of that mucosa inside the mouth is very, very important. Any sores at all should be reported to the nurse. Again, that could be a side effect of a medication. It could be because their dentures aren't quite right, or it could be something more serious. So it's very important you notice sores. The only way to know if they're not new, especially if you're not with them often, is to tell your nurse. Because then your nurse is going to have documentation of other times that people have reported issues or problems with their client. We do have people, we are starting to see more with our elderly people having teeth extracted. As I'm sure you can imagine, those who are older, it is a more involved process. It usually requires an oral surgeon. Often people have other disease processes going on as they age, so they may need to have an oral surgeon. And then they usually require more involved aftercare, somebody with them for the first 24 hours, 48 hours to make sure that they tolerated it well. And we are seeing more of that, mostly in many cases, because we're seeing people live longer and the teeth don't stay healthy or strong forever, and it causes infection when that happens. Sometimes the only thing to do is to take those out. So our role in that is obviously to keep them safe, make sure that they take the antibiotics after, make sure that there's no excessive bleeding. But the most important role, obviously, is prevention for us. So making sure that we are encouraging good mouth care. Flossing tends to be much more difficult as we age. We do have some new gadgets that help in that. Electric toothbrushes, the water pick to get in there. They even have the little handheld picks to floss with if your person doesn't have good dexterity with both hands. You can also assist them with flossing. It's very important to keep what teeth, particularly if they've started to lose some teeth, to keep the teeth they do have in good health, obviously. So let's talk about assisting, your role in assisting with the actual oral care. If your person is alert and they're able to do for themselves, you want them to do what they can for themselves, but you want to make sure it's being done well. You want to be right there. You want to make sure that obviously they have toothpaste on the toothbrush. You want to make sure that they're really getting to the back of the mouth. If they are not, when they are done, you might offer, I noticed you had an issue here. I want to make sure I get back there. Keeping the teeth that they have in good health is very important. Always wear gloves. I don't think I have to tell you that. Let's talk about oral care to our vulnerable patients. We do have clients that are bedbound, or they may be unable to see to their mouth care. Mouth care is so very important in that population. So how, mechanism-wise, how do you make that happen? So what you would do is you would turn them on their side, and you would wash the side that they're on so that the saliva comes out on that side to minimize choking. Go to the other side and do the same thing. There are toothettes that you can use. One thing I did want to discuss is end-of-life care. Mouth care during comfort care and end-of-life care is so important. Often at end of life, people don't have the strength to keep their mouth closed, so the mouth may be open. You want to make sure you're using toothettes and water. One thing I would be very careful of, sometimes people use straight mouthwash. Straight mouthwash burns. It is very uncomfortable, especially if the inside of the mouth has started to crack from dryness. So using toothettes and some warm water, you want to make sure that you squeeze it out on the side of the cup because you don't want too much water in the mouth if they're no longer swallowing. You want to make sure you get all the way into the back and around the sides. You usually would use 2 or 3 toothettes to accomplish that. There is also a special mouth moisturizer. It kind of looks like chapstick. And that actually can be used on the inside of the mouth. It's water-based, it's mint flavored, and you can actually put it on the tongue, on the inside of the mouth to coat those mucous membranes to help keep some of the moisture in and decrease sensation of pain in those areas as they dry out. Mouth care at end of life is just so very important. You want to make sure you're doing that. If the person is no longer alert, I would recommend hourly, especially during the day or near end of life, to help them with comfort and to make sure that those mucous membranes stay moist during that time. If you have any questions about how to do any of those things, or you are noticing an issue with your person regarding how to provide mouth care to them, don't ever hesitate to speak to your nurse about it. Good oral hygiene is so very important to the health and the comfort of our clients, and your role in that is often pivotal. Often people are unable to adequately see to the oral hygiene for a multitude of reasons, dementia, physical issues, and so your role in that is just so very important. Please make sure that you review your learning packet. There is some information I really didn't get into, like technical, like the name of, the inside of the mouth, the different areas, because what I really wanted to convey to you is the importance of the care that you provide, which I know you know. Thank you for joining me today. I did want to take another opportunity to thank you for the care that you provide and for helping us in our mission to improve people's lives. I hope you have a wonderful day.